Hello, my name is Jason Frost, CEO of Atlantic TRT. I want to thank you for your interest in our company and congratulate you on taking the first step to getting your hormones balanced and getting your health on track. At Atlantic TRT, we help men as well as female patients. On this video, I will be walking you through the process of becoming a new patient with Atlantic TRT. The first member of our team that you will be meeting is one of our onboarding specialists. Their job is to learn about your chief complaints and your overall goals. On this phone call, they will also be walking you through the process of getting your blood work done and setting up your telehealth call. I urge you to take your time on this call and tell them everything that's going on, all the symptoms that you are experiencing, so that they can communicate this to our medical team for your telemedicine visit. At Atlantic TRT, the majority of our patients are either veterans, active military, or first responders. We also have many patients from everyday walks of life. Just because you're not a veteran doesn't mean that you're not experiencing micro and macro traumas in your life that can be diminishing your hormone levels. These can come from stress at work, even stress at home. On this call, our onboarding specialist will explain all these symptoms to you and what can possibly be causing them. This call can take anywhere from 10 to 45 minutes so that they can explain everything thoroughly to you. The first email you will be receiving from your onboarding specialist is a DocuSign that can be filled out on your computer or your phone. This is a simple medical history form. We want to know any current medications you're taking, any past surgeries you've had, any family history of diseases, so that we can help put together a custom tailored protocol to you. Please disclose any current doctors that you are seeing for even skincare so that we can treat you properly. The second email you will be receiving from your onboarding specialist is what's called a blood requisite form. You can take this into any local LabCorp facility near your home or your work. If there is not one located near to you, we have something called blood in a box that you can take into a local hospital or walk-in clinic so that you can get your blood panel completed. Our comprehensive blood panel is 26 panel blood pool for males and 28 panels for females. This is a much more extensive blood work than you will receive from your GP. A normal comp metabolic panel from your GP is about a quarter page long. Our blood work is 4 pages long worth of biomarkers. We will be checking, obviously, your hormones, your testosterone levels, your estrogen. We will be looking at your A1C, your prostate levels, checking for any vitamin deficiencies, your liver values, see everything that's going on under the hood. We will receive your blood work results in 4 to 5 business days. I encourage everybody to at least get their blood work done to check for any underlying conditions. We have uncovered several patients under the age of 40 with prostate cancer that would not have seen this or checked for it until the age of 45. You owe it to yourself and your families to make sure that you are in optimal health. After we receive your blood work results, we will be scheduling a telehealth call for you. If you have not completed a telehealth call before, it's similar to a doctor visit over your phone or computer with one of our licensed clinicians. At Atlantic TRT, our telehealth consults are very in-depth. They will be going over that blood work with you line by line, letting you know what is high, what is low, and explain some of the biomarkers on there that you might not be familiar with. After this call, you will be receiving an email with a custom tailored list of recommendations and a copy of your blood work. These recommendations are based off of your telehealth call, your blood work, and everything you provided to us in your DocuSign medical history forms. This is custom tailored to you. We do not believe in a one-size-fits-all program for our patients. You will be contacted by one of our patient coordinators. This will be your point of contact moving forward as your concierge at Atlantic TRT. Please call them with any questions. You are never bothering us. Their job is to go over your recommendations with you, explain how all these medications work, and help you place any orders for you. The question we get all the time is, how much testosterone will I be taking? What peptides will I be taking? Do I need B12? To answer all this, we need to really see what your blood work results are before we have any of those discussions. basic testosterone therapy, to give everyone a ballpark, will run between $45 to $50 a week. When I say basic testosterone therapy, I am referring to brand name testosterone, something to keep your natural testosterone online, either enclomiphene, gonadorelin, or HCG, and another medication, typically anastrozole, to manage your estrogen levels. You will be in constant contact with your patient coordinator, having access to their personal cell phone, as well as our medical staff if you have any questions. Once your medications arrive, you will be going over the correct protocol and injection techniques with your patient coordinator. At Atlantic TRT, we are able to ship out a 10 or 20 week protocol to our patients. We encourage everybody, if they are able to order up to the 20 weeks at a time to ensure the medications are on hand. You will also receive a discount from the pharmacy. Please talk to your patient coordinator about these discounts. It is important to stay in constant contact with your patient coordinator, especially for your first 2 orders, to make sure that you are taking all the medications properly. We will be checking in with you periodically to make sure everything is going as planned. Like I said at the beginning of this video, you are not bothering us. Please do not hesitate to call or text us if needed. Your patient coordinator will also be helping you with your refills. We understand that life happens and things change. If you are ever going through a hardship, don't let a financial reason be the reason to not answer the phone. We have a hardship program in place if something like that does occur. We understand some of these calls are hard to have and sometimes embarrassing. With that being said, same for new patients. Don't be scared to give us a call. We're here to educate you. I thank you for your interest, and I look forward to having you as a new patient at Atlantic TRT.